On behalf of the Military Family Research Institute at Purdue University, I am pleased to welcome you to the launch of the 2024 Measuring Communities Spotlight Report, the financial well-being of military and veteran families in the United States. This year marks an exciting evolution in how we share insights about our military-connected communities by introducing the Measuring Communities Spotlight Reports. This series offers a deeper, more focused analysis of the key domains that shape the lives of military and veteran families. Our inaugural Spotlight Report examines the domains around the financial health of military-connected families. As we progress through today's presentation, you're invited to submit any questions you may have using the Q&A feature you see on your screen. We have staff monitoring and answering the questions throughout the event. If you're watching this recording after the event, you can instead simply email your questions to mfri@purdue.edu. The Military Family Research Institute conducts research and also develops and delivers evidence-informed engagement and outreach aimed at improving the quality of life for military and veteran families. Our strategic goals include supporting military and civilian communities in their work to assist families, generate important new knowledge, influence policies, programs, and practices, and sustain vibrant learning. All of our work is guided by the recognition that military and veteran families must interact with multiple systems to obtain the resources they need. We work to forge stronger, more efficient connections between existing systems to help them do their work. We work in multiple domains. In the behavioral health space, we co-lead STAR Behavioral Health Providers, which prepares community-based therapists to serve military-connected clients. Over 3,000 therapists are now, as well as thousands of community professionals who can make referrals, are now part of the STAR Behavioral Health Providers program. And they serve thousands of service members, veterans, or family members each month. In the area of food insecurity, MFRI created the Reaching Rural Veterans program to bring emergency food systems, faith communities, and local and state and federal agencies together to serve low-resource veterans living in rural areas. In higher education, MFRI is fighting the isolation and frustration of women student veterans with its Focus Forward Fellowship program, which promotes academic and career success and mobilizes peer support for women veterans pursuing degrees at higher education institutions. We are currently conducting a national study to examine the long-term consequences for children of their parents' deployments early in life. Operation Military Experience is checking in on the OIF-OEF generation of children to learn about their experiences, hopes, and dreams. If you yourself or someone you know has children aged 11 to 16 now who experienced a parental deployment early in life, we would love to connect with you. We're especially eager to connect with women service members, families of color, and other families whose stories are often not told in existing studies. We want their stories to be represented. Part of the dream for measuring communities has always been that it would be an instrument for achieving collective impact, a way for the many organizations serving military and veteran families to work together and ensure that our nation's promises to those who have served and their loved ones are kept. Measuring communities is all about the places where military-connected people live, work, go to school, and play. Military-connected people are in every city, town, and rural area in our country. Many organizational and community leaders are eager to support military-connected people, but they need accurate information in order to do so. All of the trends you are hearing about in the news today play out in place-based stories: food insecurity, housing difficulties, and employment challenges look different. And so too do community strategies, supports, and successes. One very special element of measuring communities is the data potluck, where partner organizations make data they have gathered available to others in the community via the Measuring Communities portal. Too often, data are gathered and sit on hard drives or only benefit the work of one organization when they can do so much more. Giving powerful tools to organizations that already make an impact on the lives of military-connected people can help them expand their reach even further. Collectively, these organizations reach millions of veterans, service members, and their families across the United States, and Measuring Communities helps them do their jobs better. We're grateful for the generosity of our partner organizations, several of which are represented in our audience today, who share their data through Measuring Communities: the American Red Cross, Blue Star Families, the Elizabeth Dole Foundation, and the National Guard Bureau. Thanks as well to the funders and partners who have made Measuring Communities possible. I especially want to express our thanks to the Purdue Center for Regional Development, which has given its technical expertise and guidance from the very earliest design phase. And I want to also acknowledge the financial support provided by Lilly Endowment. Over the next hour and 20 minutes, you will hear from members of our MFRI team and from our collaborators. We'll cover key findings from the report. The National Military Family Association will share policy implications based on these findings. And a Measuring Communities user from VetJobs will share how she has used the data portal with employers and contractors who work directly with service members and veterans. We aim to leave time for questions at the end, so be thinking about what you might like to ask. I will also note that we will be distributing the full report via a QR code on our last slide of the presentation, as well as an email at the conclusion of the day. We will also be sending the link to the recording of this event. If you are interested in viewing these data in a local community near you, we will also provide a member ID to access data in the Measuring Communities online data portal, which we will talk about later on in this presentation. Now, I would like to welcome Katie Walter to discuss key findings of the report. Katie is a senior community outreach specialist here at MFRI, where one of her primary responsibilities is to promote and help manage the Measuring Communities site. She also conducts trainings for individuals and groups about how to effectively use the data portal. Before joining MFRI in 2021, Katie worked for a major health system as a community health improvement coordinator. Welcome, Katie.
Thank you so much for the introduction, Shelley. In the upcoming slides, I'll share a few important and emerging findings from our 2024 Measuring Communities Spotlight Report. Most importantly, I want you to know that this is just a preview of findings and is truly just the beginning. All sources, context, details, information, more data can be found in the full report, which will be distributed at the end of this launch. Also, for many of these topics, you can discover what this means and these findings mean for your community. As Shelley mentioned, you have access to the Measuring Communities online data portal. I'll share how to log in to the data portal towards the end of my slides today. As always, if you have any questions or general insight, please post and engage with us in the Q&A chat feature. We have staff online ready to answer any questions or take notes. We especially like to hear how you're using data within Measuring Communities and from Measuring Communities in your scope of work or influence. You'll also see my email, actually not yet, in the chat. Please use it to connect with me. All right, let's dive into findings. Demographics. Our nation's military and military families. Nearly 2.1 million service members make up our military, according to the 2022 DoD Demographics Profile Report. However, between 2017 to 2022, our nation saw wavering numbers in service member populations, ultimately declining during this period. As you may already know, military branches such as the Army and Coast Guard missed their recruiting goals in fiscal year 2022. The Coast Guard specifically missed its goal for the fourth year in a row. And the number of people who are age eligible for military service has been falling, as well as the percent of military recruits who otherwise qualify for service, given things like obesity, physical and mental health problems, misconduct, or aptitude. This reduction in force size and ongoing recruitment challenges have raised concerns about the military's ability to maintain its readiness and capacity. As these issues continue, a lot of focus is being given to factors that contribute to recruitment and retention. Strengthening the support and stability of our current service members and their families is often a key strategy for military recruitment and retention, as military families are among the most effective advocates and overall recruiting pools for military service. However, if propensity to serve declines among military families, then the military must work even harder to meet its recruiting goals, something we've seen as already a significant challenge. Over time, the military family population has steadily declined and is declining at a faster rate than declines in the service member population, meaning the decline in military family members is not just solely tied to a declining service member force. As you can see in this slide, just about half of all service members now report having a spouse and/or dependents, which is a number that has steadily declined since at least 2017. We can start to understand these trends by looking at the general population. Across the country, young people are delaying or even foregoing marriage and children altogether, but are still coupled up and living with romantic partners. In fact, the prevalence of partnered couples is relatively stable over time, given that rises in non-marital households and declines in marital households relatively offset one another. For married households specifically, though, we're seeing fewer with children and more without children. Reasons for these trends point to things like overall changing cultural norms regarding the ideal age to be married, if at all, or the financial considerations for starting a family. Demographics and our nation's veterans. In 2022, approximately 6.6% of the adult population, or 17 million adults, identified as veterans, which is a decline of approximately 2 million veterans since 2017. Our veteran population includes more women, more veterans who identify as part of racial and ethnic minority groups, and veterans with more service-connected disabilities. Specifically, between 2017 to 2022, the women veteran population grew by almost 57,000 women. In fact, women make up nearly 10% of the veteran population, though individual states and communities vary. The top two states with the highest percentage of women veterans are Virginia and Alaska, both at 14%, while the top two states with the highest number of women veterans are Texas and Florida. The number and proportion of veterans who are part of racial and ethnic minority groups is also growing. In 2022, approximately 29% of the veteran population identified as being part of a racial or ethnic minority group. In 2022 specifically, our nation has more veterans who identify as multiracial, Hispanic or Latino, Asian, Native Hawaiian, or Pacific Islander, and as another racial or ethnic group that's not currently listed on census surveys. While diversity among the veteran population is increasing, it's also important to keep in mind that the veteran population still remains relatively less diverse in terms of race and ethnicity than the non-veteran population. Also, the number of living veterans who served during the post-9/11 era, which is the timeframe of 2001 through present, increased by approximately 838,000 veterans between 2017 to 2022, while the number of Vietnam and World War II veterans is declining. The VA recently reported that veterans who served during the Gulf War, which is the timeframe of 1990 through present, have more service-connected disabilities on average than veterans who served during earlier eras. Specifically, the average number of disabilities per veteran who served during the Gulf War era is 8.3, which you're seeing on the slide here, which is nearly double that of Vietnam veterans and almost 4 times higher than World War II veterans. These findings indicate that the veteran population is now likely experiencing more health challenges than previous generations, which likely require more medical, mental health, financial, and employment support. Disabled veterans are generally at higher risk for food insecurity, housing instability, employment challenges, and other financial instabilities, which we touch on in this report. Community. Military-connected families in rural communities. The community in which families live, work, and play also contributes to health and well-being. According to the DoD's 2024 Deputy Secretary or Secretary of Defense Memorandum, over 2 million military and civilian personnel live and work on 538 installations across 25 countries, with over 1 million rotational and permanent bed spaces and approximately 250,000 homes for service members and their families. For families stationed in the U.S., historically about 1/3 live on military bases, and the remaining 2/3 reside in community neighborhoods. While active duty families may live close to installations and military family resources, selected reserve and veteran families often live farther away from training locations, armories, and benefit services. In fact, approximately 8% of active duty service members, 16% of selected reserve members, and 17% of veterans live in non-metro or rural communities, defined by the USDA's Rural Urban Continuum Codes, which is what you're seeing on the slide here. This means that approximately 3.1 million service members and veterans live in communities that are naturally more rural, where support and resources may be harder to access. Research indicates that families thrive in communities that promote social connection and offer concrete support in times of need. Blue Star Families also recently reported that military and veteran family respondents who feel a greater sense of belonging within their community not only report overall greater well-being, but are also more likely to recommend military service to others. These findings suggest that whether living on base or in civilian communities, military and veteran families need communities and neighborhoods that promote connection and support, and military recruitment might depend on it. While the majority of the military and veteran population resides in metro areas where resources and connections are easier to access, though potentially with higher costs of living, a significant number still live in rural regions where access to services and opportunities for social connection can be more challenging. Financial. Veterans and food insecurity. Multiple agencies recently reported that approximately 25% of active duty families report food insecurity. Earlier this summer, the Military Family Advisory Network reported that nearly 28% of currently serving family survey respondents, which also includes Reserve and National Guard families, reported food insecurity. These percentages are double the proportion of the general population who identify as food insecure, which was 12.8% in 2022, and now statistically growing at 13.5% in 2023. Currently serving military families are also not the only military-connected families who experience food security issues. Research suggests that veterans tend to be at high risk for food insecurity, given the risk factors for unemployment, mental health conditions, and housing status. Current estimates share that approximately 7.5% of the veteran population, or 1.4 million people, are food insecure. For working age veterans, these numbers rise. Specifically, the USDA found that food insecurity is higher for working age veterans who have a disability, are unemployed, or who are female. According to the census, approximately 1.1 million veteran households used SNAP benefits in 2022. This number is a slight increase over the previous year, but has steadily decreased since 2017. Still, veteran households headed by women tend to have a higher percentage enrolled in SNAP than those headed by men, a trend we've seen across time and represented in the map figures on your slide here. Research also indicates that food insecure veterans are consistently less likely to be enrolled in SNAP than their food insecure non-veteran counterparts. Food insecure veterans who are less likely to enroll in SNAP include veterans with a disability, who are 70 and older, and who live in states that have one or no policies to facilitate SNAP enrollment, such as Kansas and Wyoming. Many military-connected families also report a sense of stigma, whether social stigma, career-related stigma if they're still serving, or both kinds of stigma, with asking for and accessing food-related resources. It's also likely that the use of food resources like SNAP would be higher or would more accurately address needs if the financial thresholds for resource eligibility were more appropriately aligned with the family's own assessment of their needs. Reports highlight that eligibility thresholds for food-related assistance are too low for most families who experience financial challenges. For military-connected families specifically, many programs count military or disability benefit payments as part of the family's income that end up pushing families outside of eligibility thresholds for assistance programs. Specifically, military housing allowance is included as income for SNAP, while most states don't include military housing allowance for WIC eligibility. Housing, military-connected community, and housing burden. Rising housing costs, inflation, and high mortgage interest rates have become significant issues nationwide, which then affect both military and veteran families. Housing instability has then become a concern for both the DoD and the VA. There's not a standard definition of housing instability, but things like difficulty paying rent, spending significant portions of your income on housing costs, and substandard housing quality are just a few things that are often used to assess housing instability. Housing cost burden occurs when household members spend more than 30% of their household income on housing costs, and severe housing cost burden occurs when that number exceeds 50%. Currently, there are 68 U.S. counties where 20% or more of the population experiences severe housing cost burden. A lot of these counties are in heavily populated areas of California, New York, and Virginia. While there may be no precise estimates of military-connected folks who are experiencing housing cost burden, approximately 1.4 million veterans and service members live in these 68 U.S. counties. As we know, the DoD provides a basic allowance for housing, or BAH. Its purpose is to provide a form of compensation for service members to find adequate rental housing in safe neighborhoods near their duty station when on-base housing is not used or accessible. BAH rates vary based on rank and whether the service member has dependents. However, the number of dependents is not included in the calculation, so families with many children may have housing costs or needs that exceed the BAH allowance. The Government Accountability Office also found that some of the BAH calculations might be inaccurate for some geographical areas and therefore may be contributing to financial hardships for service members. Recent surveys indicate that housing costs are a significant financial stressor for military families. In fact, Blue Star Family Survey respondents with housing costs that exceed their BAH allowance were less likely to recommend military service to others. These findings suggest that housing costs do not just affect the financial health and well-being of current military and veteran families, but they also might affect service members recommending service to others, which likely impacts military recruitment and retention. Employment, military-connected community, and employment. Employment is also important to assess the financial health and well-being of military-connected families. Specifically, recent data points to the employment outlook for women veterans with service-connected disabilities and military spouses as a significant concern. The unemployment rate for veterans with service-connected disabilities increased to 6% between 2022 to 2023. During this period, the unemployment rate for veteran men with service-connected disabilities slightly rose, while the unemployment rate for women veterans with service-connected disabilities rose at a much higher rate. In fact, the unemployment rate for women veterans with service-connected disabilities surged from 3.2% in 2022 to 12.3% in 2023. This unemployment rate tends to be a bit more variable than other rates, and of course lends itself to further analysis. Military spouse employment is also a significant yet consistent issue. The unemployment rate among active duty spouses has remained high with very little change over the last decade. Specifically, the most current unemployment rate for active duty spouses is 21% in 2021, and the unemployment rate for selected reserve spouses is 7% as of 2019. These unemployment rates are not only higher than the general population, but also exist despite labor shortages that highlight more jobs available than workers to fill them, and many federal initiatives to support military spouses, such as the Military Spouse Preference Program, the Military Spouse Employment Partnership, and the Military Spouse Employment Act. Of military spouses who are employed, about 1/3 report working part-time, which is nearly double the percent of like-aged women in the general population. In today's economic environment, many families need 2 incomes to maintain a certain quality of life. Military families, of course, are no different. Military family income has not kept pace with that of non-military families, largely due to these disparities in spousal income. A recent report indicates that the average non-military household income is almost $14,000 higher than the average income for military households, which again is primarily due to the income disparity between military and non-military spouses. Unfortunately, this income gap widens when military families relocate and the spouse has to find a new job potentially. The DoD also reported that spouses looking for work spent approximately 19 weeks doing so, which is over 4 months of time. This loss of income during this time can cause significant financial strain for the family unit. Spouses often cite 2 major challenges with military-related moves, and they are finding employment for the spouse and the loss of income for the family. If families move every 2 to 3 years, the cycle repeats multiple times, which compounds financial strains and leads to these difficult discussions and decisions about the spouse's long-term career paths. The DoD also reported a 7% drop in spouse satisfaction and overall support for their service members staying on active duty. This satisfaction and support rate has been declining over the last decade. Also, recent reports point out that the vast majority of married service members indicate that challenges with their spouse's employment and the spouse's ability to maintain not just a job, but a broader career could be reason enough for them to leave the military. Concerns with military spouse unemployment might also negatively influence the propensity to serve among potential military enlistees or recruits, which could further impact military recruitment efforts. The military has been increasingly targeting older recruits who may be more likely to be married or sensitive to perceptions of military spouse challenges. Overall, these findings suggest that more attention or research is needed to understand the current state of unemployment for women veterans with service-connected disabilities specifically, and that spouse employment issues have an impact not just on military retention, but possibly even military recruitment. In conclusion, today I shared a few important and emerging findings from our 2024 Measuring Community Spotlight Report. Like I said, this is just a preview of the findings. More information, more data can be shared and will be shared in the full Measuring Community Spotlight Report after this launch here. But for today, specifically, I discussed one, the makeup of the military continues to evolve. Fewer service members report having family responsibilities. The military family population is declining at a faster rate than declines in the service member population. These findings require us to support and strengthen our current military families, especially for military recruitment and retention. Our veteran population is diversifying. More women and more veterans who are a part of racial and ethnic minority groups are part of our veteran population. Veterans now are also with more service-connected disabilities potentially than generations before. These findings require us to evolve our approaches in serving and supporting our veterans. The communities in which families live, work, and play also impact health and well-being. Approximately 3.1 million service members and veterans live in non-metro communities where resources might be more limited or harder to access. Food insecurity is prevalent among our nation's military-connected families. Veterans specifically tend to be at high risk, yet food insecure veterans are consistently less likely to enroll in support programs like SNAP. Effort should be made to alleviate financial hardships and get our military-connected population connected to resources and supports. Service members and veterans alike are facing significant housing cost burdens. Findings suggest that housing costs don't just affect the financial health and well-being of current military and veteran families, but also might affect service members recommending service to others, which likely impacts then military recruitment and retention. And lastly, the employment outlook for women veterans with service-connected disabilities and military spouses is especially concerning. Overall, findings suggest that more attention or research is needed to understand the state of unemployment for women veterans with service-connected disabilities. More research is also needed to understand the challenges or geographic needs associated with military spouse employment, as military retention and possibly even recruitment depends on it. As I've mentioned, the report will be shared at the end of this launch. If you have any questions, by all means, please connect with us. Again, reach out, engage with us in the Q&A chat feature. And then lastly, please also remember that you have access to military-connected data at your fingertips through our Measuring Communities online data portal. To access this portal, navigate to www.measuringcommunities.org or use the QR code on the right of the slide here. Specifically, this QR code will take you to www.measuringcommunities.org. Click the first button on the pop-up window, Explore Web-Based Data. If you don't see this button, this means you're already logged on. Enter your member ID. IDs are specific to agencies, organizations, or coalitions. If you don't already have a member ID, use the member ID report 24, that's a capital R, report 24, one word phrase, to access Measuring Communities. I'll be checking in with folks who use this ID after the launch to create IDs specific to your agency. Please also know that these IDs will be saved for 90 days. Then you'll have to re-enter this ID, so keep it handy or reach out to me if you believe you have a member ID but don't remember what it is. My email address is on the slide here in the bottom right side of the page, so please connect with me. After you enter your member ID, then you'll enter your name and work email address and click Submit. Please reach out to me if you'd like me to bring a customized Measuring Communities tutorial or data deep dive to your community, or would like to view a self-guided tutorial on how to use measuring communities via YouTube, I'm happy to connect to assist you in using data to make evidence-informed decisions that support our military-connected populations. Again, thank you so much. And please also direct your attention to any polls in the chat feature too. Thank you so much. Back to you, Shelly.
Thanks so much, Katie, for sharing those insights from the report. We now welcome one of our collaborators and users of the Measuring Communities online data portal, Kelly Ruska. Kelly is the Government Relations Director for the National Military Family Association, where she leads the association's advocacy for the families of the 8 uniformed services and monitors the range of issues relevant to their quality of life. NMFA works to support and enhance the quality of life for every military family, and their mission is to serve the families who stand beside the uniform. Kelly began her work with the association in 2007 as a government relations deputy director and worked as outreach coordinator in 2014 before assuming her current role in 2015. Kelly has represented military families on several committees and task forces for offices and agencies of the Department of Defense and Military Services. She serves as the Families/Survivors Vice President of the Military Coalition, an organization of 35 military-related organizations. She is also co-chair of TMC's Survivor Benefits and Membership and Nomination Committees. From 2008 to 2011, she represented NMFA on the first DoD Military Family Readiness Council. Kelly will share with you some of the possible policy implications based on the findings in the Spotlight report. Welcome, Kelly.
Thanks, Shelley. We really appreciate you inviting us to participate. And I want to just start by saying that from an advocacy perspective, we love the Measuring Communities report and use it extensively. The report allows us to do a multitude of things, understand community needs, tailoring programs and services, evaluate impact, enhance coordination, and most importantly, raise advocacy and public awareness. The Measuring Communities report informs our advocacy. For example, the Spotlight report on the financial health of military-connected families is extremely timely. Congress for the past year, especially the House Armed Services Committee, has been looking at the financial stability of military families. And in this year's, in the fiscal year 25 House version of the National Defense Authorization Act, introduced and included numerous provisions that help address the issues that the report raises, such as military spouse unemployment, housing concerns from military families, and they've offered policy solutions to address it. The Measuring Communities report does a great job of highlighting it. It also, by using data from a multitude of sources, it helps especially new staffers better understand the military-connected community and introduces them to those organizations that are doing research. And once they can identify those organizations, and they can reach out to them to get a much deeper dive. We especially appreciate the data potluck that Shelley mentioned earlier, where partner organizations make data they've gathered available to others. This ensures that the data just isn't sitting on a shelf, and it it ensures wide distribution. And we find it especially helpful because sometimes it can give us access to data that we would not normally have access to. Um, Also, the way that the report breaks down the data from a national, state, and local perspective, it makes it appropriate for policymakers across the entire spectrum, whether you're looking at working with federal policymakers, state or local policymakers. We really appreciate MFRI's commitment to making sure that this information is available. And from a policy standpoint, it allows advocates such as ourselves and policymakers to leverage the data and insights provided in the report so that we can create more targeted, effective, and responsive policies that address the real and evolving needs of military families. So thank you again, and thank you very much for making this data available.
Thanks so much, Kelly. Next, I would like to introduce Mrs. Danette Hayes, who serves as the Director of the Reserve Component Programs with VetJobs. VetJobs provides job placement and career development opportunities for all military branches, military spouses, and dependents, as well as the National Guard Challenge Program for youth. Danette was instrumental in the development of the National Guard Employment Council, which works with senior leaders and industry influencers to advocate for and support the retention and employment initiatives of our National Guard and Reserve components. Danette will share how her team is using the Measuring Communities data portal to support national employment efforts for the military-connected population. Welcome, Danette.
Am I on? Hi, Shelley. I'm not sure you have my video.
I can see you just fine.
Okay, great. So thank you, Shelley and Katie, for inviting me. You guys know I'm a huge fan of this information, especially this report. I think when I first met Katie, we had invited you to the summit. So we hosted VetJobs with Military Spouse Jobs, hosted the first National Guard and Reserve focused employment summit this past April in DC. And Katie was gracious enough to come out and share the report with a lot of our partners in the military space for employment, but not just employment, but also for transitioning service members. So our RCTAAs and other organizations supporting the hiring initiatives for military affiliated service members. I think one of the biggest takeaways of this data is it really helps connect the dots for a lot of our family programs service people in telling the story on what's going on in their states. Being able to see it in a map, a heat map or whatever we call it these days, but being able to see the data as it's printed out in a map really does have an altering effect on what you think you know about what's going on with our family members and our service members compared to what the data is telling us, right? So I think the really important part here is understanding how this data now becomes part of that story, how it helps us have those conversations with our family programs folks on military spouse underemployment or unemployment. How we use it in VetJobs, though, is a lot of times I have recruiters and employers reaching out on how do I find military service members with a certain MOS or AFSC, or also spouses. And this helps us to share with those employers where they can, hone in to a specific area and find military affiliated candidates that could support their open roles. We're starting to do a lot more with states when it comes to the Measuring Communities information. I think I reached out to Katie just a few months ago. We had a state reach out. We want to hear more about childcare. What is the impact that childcare is now having on unemployment and underemployment for our families, especially in the Guard community and also in the reserves community. So I think just having access to this data has really helped us connect the dots for our partners, but also those contractors that we work with. We have a whole component of our CTAAs who are working in the community with our service members who now have access to data to help them understand, where we don't have connectivity for our families, where they may not all have a computer in their home, where they may not have access to, cell coverage, things like that, that are going to impact how well we move forward with the employment. It's hard to get support to our employers and have them go into a community that doesn't maybe have public access to transportation, where they won't have access to a home computer, so they're not able to apply online. Things like that has really helped paint that picture and make it a little more thoughtful for the folks who are working with the community, so our service member community. Also going forward for our next summit, of course, we'll want to roll out the new data, but I think it's just more of, it is compelling to see the data in the maps, and it's hard to articulate without, more detail, but it's just one of those situations where you see it and you start to connect the dots. And I think it's just really a great tool for our community members and for our service partners.
Thank you very much, Danette. Now we have time for your questions. And by the way, Danette was talking about access to computer and broadband, and she, I know, is referring to something that you'll find in the tool, which is a map of the digital divide. Our great colleagues at the Purdue Center for Regional Development track the digital divide across the country and have been producing maps about that. So that's something that you can find if you go there. Now, I see that there is a specific question for Danetta, or for Danette, I'm sorry, sorry, Danetta. Kathy, do you want to ask it, or do you want to tell me what it is, or how would you like to proceed?
Shelley, it's in the chat.
Oh, I'm sorry. I must not have paged down enough.
Oh, you're fine. This is what it was. With the decline in active... One moment. Let me see if I can find that, Shelley.
Oh, no, I see that question. I didn't realize that was for Danette. I can ask that, absolutely. With the decline in active duty recruitment and retention, what is the prediction regarding the strain that will put on the National Guard and reserves? Do you have any thoughts about that, Danette?
From a VetJobs perspective, or from a past military spouse who supported a accident general for the state. So
whatever source of expertise you would care to share.
I have a lot of thoughts on that. We're starting to see some bubbles in recruiting and retention with the National Guard. It's interesting because a lot of what impacts retention and a lot of what we do with our program is make sure that our states know that we're trying to keep our service members in that state to stay employed in that state. And we do that for a couple of reasons: readiness and retention. We don't want the states to think that, we're just going to be offering jobs across the country to your service members where they'll leave that state where they are supporting either the National Guard or the reserves. But for the, I do believe the Guard is still making its goals, its recruitment goals. So that's a good sign. I think that there's been a lot of attention put on helping military spouses, and of course that child care initiative and pilot out there for serving our service members who are serving on weekends. That goes a long way. The prediction for us, I think that the Guard, as long as they can continue to meet their recruitment goals and put into place good programs that are supporting the family, as we all say, it's never really been the military's responsibility to, if they wanted you to have a family, they would issue you one. So I always tell folks we're about 260 years behind, but we're catching up quickly. And I think the Guard's made some huge efforts and increased the possibility of retaining their force with a lot of the initiatives that are in place.
You make a very good point, which is that the recruitment challenges are affecting both the active and reserve components. I know that years ago, when the military downsized in the 1990s by about a third, the reliance on the reserve component increased quite a lot. And that's why so many National Guard and Reserve folks were deployed extensively during OAF, OEF, and have now been told that they should regularly expect to deploy for lengthy periods. So to the questioner's question, it seems like we might expect increasing reliance on the reserve component, assuming that they can recruit and retain enough people to do what the country is asking of them. There was another question that was specifically posed for you, Danette. And let me just, I need to page down to it in
I
chat.
see it.
Oh, you see it. Okay, great.
Okay.
Yes, so I'll just read it so you can, so other people can hear what it is. It says, how is VetJobs really impacting post-military employment of military medics and corpsmen? These folks have really valuable training, but the questioner thinks that they probably deserve more attention than they're getting. What are your thoughts about that?
You know, it has come up a lot recently. And I'm not sure, I wish I had Amy Rossi on here. So VetJobs offers a extremely large training database supported by no-cost training, right? Where we offer a variety of different certifications and credentialing programs. And we are in talks with helping provide some more detail for the medics, more healthcare related CNA and those types of jobs in the healthcare industry. So I definitely would love to be able to take that dvs.virginia.gov information back because I think that there's a place for it on how we roll out training with other training partners, meeting that criteria that supports a non-payment to the service member. But we are seeing a lot more people who, you know, that training, especially in the Guard and Reserve community, because of the COVID efforts that occurred. There were a lot of healthcare resources coming forward asking for CNAs. Are there any guardsmen or reservists who would like to move into a CNA role and things like that? So that's a good question. I wish I had Amy Rossi here, who is our director of training, because she could definitely share more information on that. But it is one of the fastest moving careers out there as far as support for it.
Yeah, there's licenses and certifications, of course, have been a really big topic for several years, and those are so place-based in so many cases, so much variability across states. So those of you across the country who are on the call, you may have opportunities to make a difference in this regard. So don't hesitate to ask some questions in your state about ways you might be able to simplify the lives of active component members coming to your state, or reserve and guard members who are moving across states. You are a popular person today, Danette. There's another question for you, and it asks, are your employment efforts coordinated with the family readiness outreach? Are spouses able to give input into what their employment needs are?
Yes, we work directly with the family readiness individuals who are, whether they're in charge of their FRGs or the key clubs. We do have the National Guard Employment Council that is supported by senior officer spouses and also enlisted. We also have business advisors. So we always encourage our spouses to provide us information and to have input on what those employment needs are. I do believe these days tags and J1s and so on and so forth in the organizations for the Guard, they are very interested in what the employment picture looks like for that spouse, because it is a recruitment and retention issue. I can tell you at our very first National Guard Employment Council meeting that we had with the Guard and the Reserve in 2019, we had some pretty encouraging comments coming from spouses that if they could continue with their careers and not put their career on hold anymore, that they would definitely have their spouse continue after their 20-year letter. However, if the opportunity wasn't there to be able to continue their career as well, because of the growing op tempo that the Guard and the Reserve has impacted them since most likely 2011, it's no longer 30 days a year, 39 days a year. It's more around 56 days a year. So that has a huge impact on the family. But there were spouses who were like, my spouse has done it 20 years unless it's my turn, unless I can have a chance to participate in my education, continuing education and career. And that's huge. That's good information, and we can work with that.
Continuing on the theme, has the expansion of remote and geography flexible employment relieved any pressure in military spouses finding jobs or keeping jobs as they move? And here, Danette, I'm interested in your thoughts, but Kelly, I'm also interested in yours, because I know you've got your ear to the ground among military families around the country and around the world. So I'll start with Danette and then invite Kelly to share her thoughts.
I think remote jobs have definitely opened up a lot of opportunity for Guard and Reserve spouses, much like their civilian counterparts. I think daycare is still an issue, though, when it comes to the employment for our spouses, predominantly female, because they seem to be the ones who are the caregivers at home. But that hybrid schedule and remote, and we have a lot more good jobs. You know, prior to COVID, your stay-at-home jobs were more of your telemarketing, your call center. We now have, because of the COVID efforts and how organizations and companies had to, ramp up to be hybrid or remote access, they now have the capabilities to offer more jobs at a remote status. And that has definitely helped improve employment for our spouses.
Thank you. Kelly, are there things that you would like to add based on what you're seeing among families, or also what you're hearing on the Hill about these issues?
So we're seeing improvement, definitely remote and telework, geographical, flexible jobs have helped. But we're seeing that for military spouses, it's one thing to be able to have those remote opportunities if you've already been with a company and you're moving. It's a little harder to find and identify remote opportunity when you're starting to look for jobs. And so, definitely working with your current employer to create remote opportunities, it seems to be a little easier, although we are still seeing, some difficulty from certain sectors. The federal government has made, some huge improvements. The exact name of the program is completely escaping me right now, but the Department of Defense and the State Department just signed an MOU that will allow, military spouses that work for the federal government and who may be moving overseas to retain their position and work remotely. And so, that's been a huge help and hopefully will serve as a model for civilian employers.
Great, thank you. For those of you who are out there listening, one of the things that's really important for you to know is that we really are interested in the community of users, and we're always on the hunt for more indicators or better indicators. And so if there are things that you're particularly interested in that we don't seem to be offering yet, please do let us know. We've been, for example, having conversations with installation commanders about the things that really concern them, and have been looking into indicators that we might be able to add that would help them understand the areas around their installations and what's going on there. And of course, we're very interested in trying to make sure that members of Congress have access to accurate data about their districts. There's another question in the chat that asks, have you looked at some of the local or community-based factors that may be causing some of the variability in the outcomes we observe? For example, eligibility requirements for programs like SNAP or other factors. Katie, I know this is something you've thought a lot about. Do you want to share any thoughts? There might be details in the report itself that would shed light on this, but you may have some other things that you'd like to mention. Can I give you the floor for a minute?
Sure, and Shelley, please add on to any of my responses as well. In terms of looking at some local or community-based factors that might contribute potentially to some variability in results, we do have measuring communities essentially for this purpose, so that you can go in to this data portal, and we can share this at the end as well, that you can look at data for your specific community, because we know communities vary in terms of a lot of different things. And so you can go in and look at some of those different factors or different data that might be especially important for you to know for your local community. And then we're looking at profiles too. So that's really helpful when you start to dig in and you look at this thing and how they impact a variety of different data points. Shelley, is there anything else you would add to that response too?
Yeah, the questioner is asking about, for example, eligibility requirements for programs like SNAP. And some of those programs that are administered in the states have guidelines or eligibility rules that are set at the federal level, and sometimes the state can influence them, but not always. There's another set of factors where states vary quite a lot in policies that they create and operate at the state level. For example, in Indiana, if you are the child of a disabled service member, you get breaks on college tuition. And I don't know that there's a good explanation for why some states do certain things and why others do not. But I think it's probably safe to say that states that have large military presence or large veteran presence maybe more hospitable, more interested in trying to support those folks. In Indiana, though it has no installations, is actually a pretty large Army National Guard state. But there's another place-based story here as well, which is that every community differs in the characteristics of the people who live there. And so, of course, you have rurality, more urban versus more rural places, and that has implications for access to resources and other things. But mental health even varies across communities. And so the levels of poor well-being days, if you will, that people report in communities differ on these things. Social connections differ across communities. And so when we're trying to understand how and why military-connected people in particular areas are doing well or poorly, the answer very often lies in characteristics of the community as opposed to characteristics of military-specific policies. It's hard for everybody, military and civilian, to thrive in a community that lacks certain fundamentals like social connections or like mental health. And so there are clues here for people who run organizations and for local decision makers about things they might be able to do, things they might be able to tackle that will be useful for the military connected people in the community, but also everybody else. So sometimes there are things that are quite specific to the military population. Other times there are things that are more general, but will lift all boats, if you will, if it can be tackled. All right, I'm looking to see if there are more questions. Oops. I was saying earlier that we really welcome your requests. We also welcome your dilemmas. So if you ever have an interest in sharing with us a decision that you're trying to make or a policy decision you're trying to wrestle with, and you think measuring communities might be able to help you, but you're not exactly sure how, feel free to call us up and we'd be happy to walk through it with you and just try to think it through with you to try to assist you. Our goal really is to try to help you do what you do easily and better and be useful to you in any way that we can. And I know that we've had a request to pop up the another slide, and I can't see what you see. So I'm just going to assume that that slide will be visible to you at the end. Sorry, I lost track of my script here. Let me go. I will, I'm going to go ahead and conclude today's program while that slide comes up. I want to thank all of our speakers who shared not only their insights, but how they are using the data to support efforts in their work with the military-connected population. I'd also like to thank our subject matter experts who served as reviewers for this report. Their names are featured near the end of the report, and I really want to emphasize that. Every report that we prepare is reviewed by subject matter experts in that particular domain who help us determine what the stories need to be based on the data and how to present that information to you. I also want to say a special thanks to members of the Measuring Communities Advisory Council and the MFRI Advisory Council, both of whom share their input and guidance. And of course, I want to thank my staff, Katie and Kathy, who have invested blood, sweat, and tears in doing this work, as well as Ari and Sierra behind the scenes, who have been making all of this technology work. And Ari's team also tries to make sure that everything that we do looks good, even if we even if our presentation, even if my presentation doesn't always live up to his awesome standards. The full Spotlight report is now available to view. You can use the QR code on the last slide or check your email later this evening. You'll receive a link to the report as well as to the replay of today's event. You may also access the data for your local community in the online portal at measuringcommunities.org. If you do not already have a member ID, remember, Katie told you you can use Report 24 with capital R to gain access. Thank you so much for your participation today. Thank you for your use of this tool. And please share with us your stories, your challenges, your dilemmas, your successes. We want to learn from you and we want to help you. Thank you very much and have a good day.